I think the most challenging aspect for me of living with cancer and all the treatments involved are the physical changes that it's had on my body, because I've always been very outdoorsy, very athletic, and I'm not quite as strong as I was before. I'm not, it's difficult to keep my weight down to where it's always been before. So all those things have taken a little bit of a blow to me personally in something that was so important to me before, which was cycling. Climbing the hills is a lot tougher for me now, but I still get out there.
The most challenging aspect for me with this cancer is just simply the discomfort. And it's the discomfort of the medications at times, particularly when switching over. At other times, there's no discomfort whatsoever, and I wouldn't even have the slightest idea I had anything wrong with me.
One was kind of the initial impact of the diagnosis. You know, it's sort of, God, I don't believe this. Why me? I'm young, I'm healthy. And then the second, real emotional aspect of it would be the decision making on the treatment. Choosing the treatment was probably among the most distressing.
Finances, that's a big challenge because you're going to be not only having to pay some pretty high premiums and insurance if you're fortunate enough to get it, you're going to lose a lot of time off work because going through chemo, of course, there are days when you're just wiped out. Fortunately for me, I'm self-employed and I have insurance. But I think, it's been very hard for us financially. You know, it's a big, big burden.
It's been easy for us because we're self-employed to take the time off work to go and do the treatments and stuff. But I can imagine that someone that has a regular job, that they're employed, that would be, especially if they have a person like me, because I go to Chris's every appointment, trying to get the time off. I think that would be hard. So I hope they have a good boss that they let them have the time off.
I can't go without mentioning it does have some dramatic impacts on your sex life, which is something that my wife and I have really had to come to grips with.
One of the sad things, perhaps, is that my mother's still living, and she's turned 90 in the last 2 or 3 months, and I have not told her because this is what killed her husband. And so
we just can't tell her.
We've just chosen not to tell her that I had been diagnosed. And
she doesn't know that he had surgery.
No, she doesn't know anything.
Nothing.
The rest of our families do, and so hopefully they've all kept this from my mother, whether this is fair or not.
I think the most challenging aspects were, one, trying to come to grip with the fact that I had this, working with the choices in terms of treatment, making a decision of what I wanted to do, going through the process itself. And then essentially what they tell you is the PSA levels that they want you to be in, and it's a 5-year wait. Okay, so unless you come to those levels and are steady over 5 years, you're not sure that the outcome is what you expected, right? So I'm in year 2 of the 5-year cycle. Things look good. I go for my checkups, and we keep moving ahead.